Efficiency is everything in the emergency department. A minute is a lot of time to an ER physician. On the one hand, there's work to be done, but you have no idea what's coming in the door in the next couple seconds.
Open this, open that syringe.
The number one thing that an ER serves as is a point of reference for people with life-threatening conditions. The time-critical first few moments that can basically make or break whether somebody's going to live or not. So in the middle of this entire theater that's going on, there's a certain percentage, and it's a very tiny percent, of people that really don't belong there, and they're there all the time.
Just relax. We need to keep this neck brace on.
Hey, well, stay on the bed, buddy.
Hold on, just relax.
What hurt? You gotta tell me what
Hey,
hurt.
we're trying to help you out, okay?
Here, give us just a second. We're sorry. Here. Very good. Blown away.
Some people call them frequent users, some people call them frequent flyers. These are people who oftentimes have mental health issues, sometimes substance abuse issues, sometimes just chronic diseases that they're completely disconnected from care, sometimes homelessness, and sometimes all of the above. They don't seem to have any health literacy for what an emergency is. And it takes a lot of time of the staff and the physicians to see people over and over again when they'd be much better off and much more cost effectively delivered in a primary care setting. Open dictation box. Patient interviewed, examined, and discussed with emergency medicine resident, and I agree with the plans for this 55-year-old chronic homeless alcoholic who returns to the emergency room for the 19th time in nearly 30 days, period. He was discharged from the emergency room yesterday at 9:30 in the evening. The patient has a history of alcoholic cirrhosis and possibly hepatitis C, and has been followed previously at the San Diego VA Medical Center. New paragraph, physical exam, new line. Disheveled, intoxicated man who's urinated on himself, and thinks he is actually at the VA Medical Center, period. New line, cardiac exam, unremarkable. The patient will be given food and allowed a sober period. In addition, we will ask social services to contact the VA and see whether we can arrange a more assured link to follow-up care period. Transfer text. Have you tried to get back into the treatment program?
Yeah, they want me to get back into the treatment program.
Okay, so do I. So how do we make it happen? We got to move on here.
There's bus passes. I don't have a bus pass to get around.
If we could hook something up, would you maybe be able to get out there today? Are you willing to do that?
If there's just bus tokens, okay. But as the bus pass,
the resources have to be there. The social world has to be as connected as the healthcare world. And better connections that can be established for people when they walk out of the emergency room, or they walk out of the hospital or the clinic, and make sure that they really got to from A to B. That's really the key. Healthcare reform is coming in 2014. Frequent flyers are just the tip of the iceberg of what needs to get fixed.
For the nurse, Raul, she'll be over in a minute.
This little tiny population of people, and I'm only talking about a few hundred individuals, is literally generating tens of millions of dollars in bill and an awful lot of frustration in the community. Nobody's at fault unless they do nothing. Hey, what'd you bring?
ETOHSI.
Really? Mm-hmm.